My name is Ron Marsh. I'm a chiropractor. I'm licensed in this state, Rhode Island, and I practiced in this town, Portsmouth, for almost 29 years. So I've known the work that they do and how much they've been helping people. And the quality of their products is unquestioned. I use their products myself. I recommend their products to my patients. For my thinking, natural remedies, including homeopathic remedies, are clearly safer than pharmaceutical drugs. Well, a pharmaceutical drug is these are not molecules that are recognized by living systems. If they were, they wouldn't be drugs. They're chemical fabrications in a laboratory. They're organic molecules with artificial constructs which will have an expression within living systems, which will be taken up and will have physiological effects, but they're not natural. These substances induce changes which living systems are forced to go along with because that's the nature of biochemistry. Now, having said that, there are times when I would take pharmaceutical drugs. For example, antibiotics were discovered, I guess, in the 1930s. And antibiotics were responsible for saving many, many lives. And I wouldn't want to live in a society where I didn't have access to antibiotics. If I had a serious infection and that could save my life, I would want that. But the rationale runs away with us, and we begin using these substances in ways that far beyond what they should be used. And I mean, the purpose of antibiotics was to save lives with real serious infections. Now we give them to children with ear infections. Your kid looks like he has an ear infection, give him an antibiotic. Well, doctors have done this for so many years that even the medical authorities are saying don't do that. Because first of all, you're not solving the problem in the long run. And second of all, you're creating a tolerance for that in the patient, which is going to cause the ear infections to come back even at a higher rate. So this is seen across the board, where we found drugs that have real useful purposes, but we begin using them in ways far beyond their usefulness. And why do we do that? Unfortunately, because it's profitable to do that. I think there's a lot of greed. I think there's a huge opportunity for lack of accountability. Now, there is a huge structure of accountability built in. Our FDA has very stringent, or so they appear, requirements for drugs to be brought out on the market. In fact, there's a very long process, supposedly, that a drug has to be put through. But in that process, to get final approval, there becomes a very close relationship between the regulating body and the companies regulated. And I think this has caused an incestuous situation where the agencies that are supposed to be protecting us are actually end up protecting the drug companies. Conventional medicine, as we call it, has no use for natural remedies, and they don't have any use for them because you can't patent a vitamin, you can't patent a plant or an herb. There is absolutely no gain for that in the pharmaceutical industries, which is, I believe, the most profitable industry of any industry in the world. They have nothing to gain with manufacturing vitamins because they can't sell them at a big profit. They would have to sell them at the same profit that the other manufacturers do. Out of that grows a situation of monopoly and even a cartel situation where it's in their interest now to suppress the use of those. Because if people can use pharmaceutical drugs, but if they learn over here, well, I can get the same effects, maybe even better, by using these nutritional substances. Well, I'm going to do this. Because first of all, it's a lot cheaper, and second of all, my chances of getting harmed are much less than by using the drug. So that's really at the base of why the healthcare establishment, the medical establishment, the pharmaceutical establishment in this country has organized against natural healthcare. The manufacture and marketing of herbal and natural remedies needs to be protected. Our ability to learn about these and to use these has to be protected, because I think we're all the time closer to government suppression of that. And why does the government suppress it? The government suppresses it because there is such a huge economic interest urging them to do that. And we know what that interest is. Maybe up to 90% of the prescriptions written are ultimately doing more harm than good. And as we become more pharmaceutical dependent, we're also going to become less healthy. It would be a disaster if we moved closer to having a suppression of information about natural health remedies in this country. That's very close. That's alarmingly close to the way the dictators run their countries, and the way governments that suppress freedoms operate. And the only real ultimate end of that would be to protect the drug companies. And we see the purpose of that. It's promulgated, and it's always promulgated that we have to protect the public. Well, protect the public against what? There's the data supporting harmful effects of natural remedies is almost not there. There is none. Whereas the data that shows the harmful effects of pharmaceutical drugs is huge. So it's a very strange situation how what's safe over here is being prosecuted, and what's dangerous over here is being allowed to expand. It's sort of like Alice in Wonderland. It doesn't make sense. The case of Daniel chapter 1 brings it home to me in a way that I never thought in my lifetime that I would see. That a government agency would be threatening people merely for making information available. And this is not information, this is not unheard of information. This is traditional information. These are remedies that have been known, sometimes for centuries, to have anti-cancer properties. You can go back centuries into the literature and you can read. And there is some modern scientific proof, some modern scientific documentation supporting that. But because these government agencies can choose what documentation they want to accept, they can say, well, we're not going to accept your documentation, but we're going to accept the documentation from Pfizer and from Upjohn and from the other drug firms. That's very dangerous. And I didn't think I would see it come to that point, and I think Americans, most of them don't realize how close they seem to be to being told what they can take and what they can't in vitamins, in natural remedies, in herbal preparations. This should be a part of our basic freedom. So yes, we definitely have to be on guard for our freedoms to seek the remedies we can. It's ridiculous in my mind for any single authority to claim the authority to treat a particular illness, because no illness is known totally. We're constantly getting new information. What we know about cancer now is completely different from what we knew about it 10 years ago, even 5 years ago. And this is a quotation from Benjamin Rush. He was a medical doctor. Benjamin Rush also was the personal physician to George Washington. He tried to have medical freedom put into the Constitution, where there wouldn't be just one class of practitioners. And obviously he was not successful. But he said, unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship to restrict the art of healing to one class of men and deny equal privileges to others will constitute the Bastille of medical science. All such laws are un-American and despotic and have no place in a republic. The Constitution of this republic should make special privileges for medical freedom as well as religious freedom. Sort of looks like they were dealing with some similar issues back then.